Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And this is our next video in the series of Is It Really Possible to Get Out of Managed Care? Now, I want to make one thing very clear, and that is this is not the type of issue where you get inspired one day and then all of a sudden you just start bailing out of the plans. It must be done sequentially, and you must have some basic things in place before you drop even your first plan if you want to do this in a safe and secure manner. So, first of all, you must have a solid marketing plan and something happening so you're getting more new patients before you drop out of your first plan. Let's face it, and you have to confront this. Look at that number that you're writing off that I had you do for your last bit of homework. That number that you're writing off, let's say for the Acme, that's a generic company, is $15,000 a month. That's your marketing plan. That's your marketing budget. You participate with Acme and you surrender $15,000 so that they send you some new patients. That's a very, very costly marketing plan. For $15,000, you can hire a full-time PR person for maybe $3,000 a month or $4,000 or whatever, and then have lots of money left over to promote. So you must, first of all, have a marketing plan that is working. There must be some sort of internet presence, some sort of maybe direct mail, an internal marketing campaign, share the care concept, something like that, so that when you drop these plans and you lose those new patients, you're getting some patients in to replace them. We have the new patient workshop at MGE. It has a money-back guarantee. And I'm going to give you a number at the end of this video for you to call. You should definitely come and at least do the new patient course so you can replace the patients on the plans that you're dropping if you're going to lose some. Okay, then the phone is ringing with a new patient. You have to have some proper training for the people answering the phone. They have to be able to sell. When somebody says, "Do you take my plan?" and you don't, that person has to be able to sell the patient on coming in anyway. So there has to be proper phone technique. We also do that training at MGE. Thirdly, you have to be able to handle the new patient flow in your schedule. If a new patient has to wait for 2 or 3 or 4 weeks, then you're very likely they're not going to show up. Generally speaking, people call up on a brave day, and then you make them wait a couple of weeks, and they're not so brave anymore. So you should get my scheduling DVD and learn how to block time and really schedule new patients. All right? And finally, you have to be able to close cases. You have to be able to get the patient to sign up for what they need, not just what the insurance allows. Otherwise, you might as well just stay on the plans. So a few basics are you have to have some new patients coming in to replace the ones that you're about to drop. The person on the phone must be able to handle that phone call properly. You have to have room in the schedule to put new patients and get them in within a day or 2 at the outside. And then finally, you have to be able to get the patient to sign up for the treatment they need, not just the dentistry that they want. So those are all of the basics. My contact information is on the screen. You should call MGE and do the ABC Sales and Communication Seminars, and you should do the new patient course, and you should have the scheduling DVD. So with all of these pieces in place, now you have a solid foundation, so as you start to drop out of the plans, it's not going to be a big risk. And I will start talking to you about the way to evaluate your numbers in the next video. And that's my tip of the week.